Welcome to NCLEX in Practice. Today we're going to look at how to prioritize nursing interventions when a patient presents with severe abdominal pain that could be life-threatening. A 42-year-old male arrives in the emergency department reporting severe pain in his upper abdomen that radiates straight through to his back. He rates the pain as 9 out of 10. He is nauseated, his heart rate is 112, and his blood pressure is 98/64. His skin is pale and clammy. Before we get to the scenario question, let's talk about what's happening here. Pancreatitis pain is classically described as epigastric pain that bores into the back. It gets worse lying flat and improves leaning forward. But here's the critical thing the NCLEX wants you to notice. This patient is showing signs of hemodynamic instability. Low blood pressure and a fast heart rate tell you the body is under serious stress. The differential diagnosis could include a heart attack, a perforated ulcer, or a gallbladder attack. But regardless of the final diagnosis, the nurse must act on what is happening right now. Here are the possible first actions. Option A, administer full morphine for pain relief. Option B, draw blood for lipase, amylase, and a complete metabolic panel. Option C, establish IV access and begin fluid resuscitation. Option D, place the patient in a supine position and apply a warm compress to the abdomen. Let's work through each one. Option A is incorrect. Pain management is important, but it is not the first priority when a patient is hemodynamically unstable. You must stabilize circulation before addressing comfort. Option B is also incorrect. Diagnostic labs will absolutely be needed, but testing does not come before treating a patient whose blood pressure is critically low. On the NCLEX, stabilizing the patient always comes before gathering data. Option D is incorrect and potentially harmful. A supine position worsens pancreatitis pain and does nothing to address the circulatory compromise. Warm compresses are not appropriate here. The correct answer is Option C, establish IV access and begin fluid resuscitation. This patient's low blood pressure and elevated heart rate signal hypovolemia. In pancreatitis, large amounts of fluid shift out of the bloodstream and into surrounding tissue. The nurse must restore circulating volume immediately. This is a nurse-initiated action that directly addresses the most life-threatening problem, which is circulatory collapse. This follows the ABCs. Circulation is failing, and that comes before pain management or diagnostics. Now let's look at a second scenario with the same patient. 30 minutes later, IV fluids are running. Labs have been drawn. The provider has confirmed acute pancreatitis. The patient asks for something to eat because he is hungry. Here are the options. Option A, offer clear liquids since the patient is stable now. Option B, explain that the patient must remain NPO to allow the pancreas to rest. Option C, contact the dietitian to arrange a low-fat meal. Option D, encourage small sips of water to prevent dehydration. Option A is incorrect. Clear liquids still stimulate pancreatic enzyme secretion, which worsens inflammation and pain. Option C is incorrect for the same reason. Any oral intake during an acute pancreatitis flare can trigger more enzyme release and delay healing. Option D is incorrect. Even small sips of water can stimulate the pancreas in the acute phase. The nurse should not encourage oral intake without a provider order. The correct answer is Option B, explain that the patient must remain NPO. Keeping the patient NPO reduces stimulation of the pancreas. This allows inflammation to settle and prevents the condition from worsening. It is a core nursing intervention in acute pancreatitis management and a high-yield NCLEX concept. The key takeaway from today is this. When a patient presents with severe abdominal pain and signs of hemodynamic instability, you treat the circulation first. Then you manage the underlying condition with targeted interventions like NPO status. The NCLEX tests whether you can recognize urgency and act in the right order. See you next time on NCLEX in Practice.